Okay, good evening, everyone, and welcome to this webinar. This webinar is jointly hosted and delivered by the National Sheep Association and AHDB, and it's on the subject of bluetongue virus 3. This strain of BT virus is a newcomer to Northern Europe. It's causing some really serious problems in the Netherlands in particular, and you'll all be aware that it has been picked up through surveillance both in Kent and in Norfolk very recently. There have been, and there continue to be, a lot of conversations going on about this virus. There's lots of meetings and discussions taking place, but we are collectively aware that many farmers are picking up information secondhand and feel disconnected often from what is happening on the ground. So this webinar is the first in a series where we will continue to update people, but also give an opportunity for people to raise practical questions and any problems that they're experiencing on the ground, with the aim of finding solutions that don't compromise our biosecurity and our ambition to prevent this virus from circulating here in Britain. Farmers will be infected in a number of ways. They're caught up in surveillance activities and also caught up with movement restrictions. And we have an experienced and senior panel of speakers here to help us this evening. So first of all, just to say that my name's Phil Stocker. I'm the Chief Executive of the National Sheep Association. I'd like to thank you very much for joining us. The webinar is being recorded and we will make it available within 24 hours. We will circulate it amongst everyone that's on the call this evening, and it should be available both on the NSA's website and on AHDB website as well. As I said earlier, this is an introductory webinar today, and it's first in a series of webinars that we plan to do over the next few months as things start to develop and new scenarios emerge. We're going to hear from our speakers today, and then there will be a series of presentations and then an opportunity to answer your questions towards the end. We'll aim to finish ideally by 8:45, so this shouldn't last any more than 75 minutes, and we'll try and keep it on time. Please, can I ask you to put your questions in the Q&A, and we'll keep a close eye on them and deal with them at the end. Try and avoid putting them in the chat. Do put them in Q&A. So our panel today is Sasha van Helvoort. Sasha is the veterinary head of field delivery within APHA. Sasha is going to be talking about the background to the virus, how we find it here, how we found it here in the UK, what testing is being done, some of those surveillance activities, and also just going to mention movements of livestock and licensing of movements of livestock as well. We've also got Rudolf Reichel. Rudolf is the APHA veterinary lead for small ruminants. And Rudolf is going to be taking us through the clinical signs of bluetongue virus. Then we've got Sharminda Lockwood and Jack Balcom. Sharminda and Jack are both vets down in Kent, close to the control zone in Kent. They're from West Point Farm Vets, and they're both going to be doing a bit of a joint presentation, but it's going to be about the implications of for farmers and vets of being in a control zone and what can be done in a practical sense, you know, if farmers are contacted for surveillance testing. We'll then go into a question and answer session, and joining our speakers at that point will be Professor Peter Mertens. Peter is the Professor of Virology at the University of Nottingham, and he's got a long experience in virology and the knowledge of the life cycle of the main vector in terms of transmission of BTV, which is a midge-borne virus. And we've got Mandy Neville, who's Head of Animal Welfare, Health and Welfare at AHDB, and is also a qualified vet. And Mandy will be joining that discussion panel or Q&A panel at the end of the presentations. I'm just going to pass over to Neris Wright from AHDB a moment, who's going to just talk us through some of the resources that are available for farmers currently. So Neris, over to you for a moment.
Thank you, Phil. If you just keep sharing your screen, I don't see there's much point of swapping screens. So yeah, welcome everybody. I'm Nerys Wright. I work in the regional team at AHDB. So just echo Phil's welcome this evening. We just wanted to signpost you to some other information that you may be able to get access to. So there is a bluetongue resource hub on the Ruminant Health and Welfare website. So if you've got any questions there, any questions, you could look for the answers on the website. There is also a very well-populated frequently asked questions section on there. There is also the BTV hotline, which is being manned. It will be manned intermittently over the Christmas New Year period as well. So do ring that, leave a message, and somebody will get back to you. So we just wanted to highlight those resources that are available to you. And in addition to those, there is additional support. So if anybody is concerned, just be aware of the very many industry organisations that are out there that you can pick up the phone to and have any discussions. So there may be some that I have missed, and I apologise for missing any, but just to give you that idea, we've got Forage Aid and many opportunities there. So if you are worried about anything, please pick up the phone, please share your worries. There is somebody there to support you and help you. Right. So without further ado, we will hand over to our first speaker, Sasha. So Sasha works at APHA. She's the contingency veterinary head of field delivery at APHA. And Sasha, we will have Sasha's just in the background sharing her slides. So I'm just going to fill that time. Please do put questions in the chat. So we will ask one or two to each speaker at the end of every speaker. And then at the end of the collective talks, we will then do a Q&A with all of the panel that we have available to us this evening. So over to you, Sasha. Thank you.
Okay. Just seen that my date is wrong there. I just put that one today, so sorry about that. We're a bit further than the 11th of December. Right, so just to start, bluetongue, we're obviously talking about bluetongue disease. It's, as most of you are aware, it's a notifiable disease, and it can potentially spread quite rapidly, and is a significant production loss for both sheep and the cattle industry. And it's also of major importance for our international trade in livestock. So early detection is really important for the control and to give our trading partners as well confidence in our UK livestock. UK here in England, the BTV3 is still an incident. It is not considered an outbreak, and there is currently no evidence of circulating disease. And we continue to do further investigations, as you will find out as we go along. So to just go over the disease control objectives, just to understand why we are doing everything we are doing at present. So our primary objective is to establish whether there's disease circulating, whether there's viruses circulating in the midge population that is here in England, and also to detect any undisclosed infection that is out there, and hence all the surveillance we're doing at the minute. So our aim is to limit the spread of the infection through proportionate and evidence-based control measures. So we want to protect public health and safety. Now, these are all generic ones, so obviously really important for zoonosis, for notifiable diseases, eradicate any disease and regain disease freedom. So ultimately, that's where we want to end. We want to safeguard health and safety of those involved in controlling the outbreak, and we want to minimize the burden on the taxpayer as well as the public, and as well as the economic impact on the whole agricultural industry. And we need to balance all these burdens of all these controls against the benefit of actually eradicating bluetongue. So to let you know what's been happening, so bluetongue was first confirmed in our first bovine animal, and that was in the beginning of November, and that was on the 10th of November. And it was identified via our annual bluetongue survey program. So that's a surveillance we do every year, and it's done across all the areas along the coast to see if we can find any, and obviously we did. Currently, we now have 26 confirmed infected animals. That's 24 cattle. We've also found it in 2 sheep. And these are all residing on 15 different premises and 10 different keepers. And the difference between the 15 and 10 is because people also have multiple premises where they keep animals. Two of the cases, as stated, are related to sheep, and they are both found in the extended temporary control zone, and I'll come back to the temporary control zones a bit later. And the rest are all cattle, and 4 of those cattle are actually situated in the Norfolk temporary control zone. As I already stated, there still is no evidence that bluetongue virus is circulating in Great Britain, and surveillance continues again in the zones. And also to note that in all the cases that we currently find the positive animals, they've all been humanely culled, and this is to minimize the risk of onward transmission. So for the epidemiology of bluetongue, as you are probably aware, this is primarily a disease of sheep, cattle, and goats. But camelids and deer can also be infected, camelids meaning alpacas and llamas. The severity of the clinical signs can vary between species and breed and serotype, but that will be discussed after my presentation to show you all the various clinical signs. Not all the infected ruminants will show clinical signs or pathological signs, and as we've seen, all the positive cases we've had have not shown any clinical signs. And the disease is associated with insect vectors. So that's the Culicoides midges in which the virus replicates. And as you're probably well aware, everyone's had midges all around them during the summer. So we know they're here. So the source and transmission of the bluetongue virus, where does it come from? Well, it could come via imports of infected live animals, but we do have very stringent import controls, and we will always test any animals that come in for various diseases, and will even not actually accept live animals from countries that have got bluetongue virus active there. So for the BTV3. The biological vectors, as I said, was Culicoides midge. The infective period for the ruminant host, so how long can an animal be infected, is just under 60 days, but it's quite long in cattle. So you can see that that's actually a really long period. And the long range disposal of the infected midges. So midges obviously can not fly for miles and miles, but they can be carried in this in the wind as a plume of midges. So the midges just get caught up and fly across. So that's how we think the current cases have come from, a plume that just got blown over into the United Kingdom. Germplasm can also play a role in transmission. So we know there can be vertical transmission from cow to calf, but also it could be in the semen. And blood, you could also have transmission there via contaminated needles or even contaminated surgical equipment. But usually whatever is being undertaken to sterilize all those pieces of equipment, and we always use, needles are always used only once, so that should be a very negligible way of the virus being spread. So to explain the temporary control zone, as you're aware, in November we put out our first temporary control zone, and that went around the original case, and that was a 10-kilometer zone. Then we found further animals, and we noticed that a lot of them were originating from the Sandwich Bay area, and so the temporary control zone in Kent was widened a bit, so it became a bigger one. So that's the extended temporary control zone. And for the Norfolk case, again, a 10-kilometer zone was placed around that one. And if we look at the map, you can see here the one up in the north around Norwich, and here is the extended TCZ down in the Kent area. So surveillance, what's the aim? Well, we really want to inform ourselves about the circulation of virus. That's the most important thing. We also want to understand what level of infection is out there. We also want to identify as quickly as possible any infected animals so that they can be removed, so they're not a risk. And so in that way, we want to reduce or delay the risk of this disease spread in 2024 when the vector activity we know will be increased because temperatures rise. So what do we do on this surveillance? Well, for each premise is visited and a clinical examination or a clinical inspection is undertaken of all stock on site, and also blood sampling of all the susceptible stock on the premises. Now, we are, I know there was a lot of worry about young lambs, and that we are looking into that, in what age, till what age we will not be taking blood samples of them, but further information will follow on that. So we are prioritizing zones around areas where infected animals have been found, so the Sandwich Bay, and also we start around the areas where we found positive animals. And we are also concentrating on larger cattle premises because obviously there'd be more chance to find one animal in a larger herd than it is in tiny little herds. What to expect on a surveillance visit? So the visit is always undertaken by a vet, and it could also include technical staff. It always depends on the size of the farm. Bigger farms will have more people joining to undertake the work there. We always undertake biosecurity prior to entering farm, because we're not only talking about bluetongue, there are also loads of other infections that could be a risk to farm. So we want to make sure we don't take anything on a farm or even take anything off a farm. A clinical inspection, like I said, would be taken, but this also includes questions about production and examination of all the records, because we also want to know, if you go to a dairy herd, you want to know if there's been a milk drop at any point in time, because these are all indications that there could have been a problem at some point in time, or whether the animals was a period in time that they might have had more antibiotics than they would usually have. So anything that would indicate bluetongue disease. And like I said, sampling of all the stock. And that also means all stock on linked premises and TLAs. And it would be really helpful if you haven't yet registered certain areas where animals are on, if you could do that, that would really help us with finding everything. So movement controls, I said, Phil said I'd also be giving this license update, and the temporary control zone means that nothing is allowed to move unless it is licensed. So that means that there are very limited moves allowed, but there's a variety of them, and I'll go through them in the next slide. There is a derogation from restrictions, and this is in the legislation, to allow the movement of dairy cattle for milking, and but then any other move does require a license. But I do have to mention that even though there is a license available, it still might not be approved, because there could be a risk associated with that move. And then the risk is, if it's too high, then the move might not be allowed. So just be aware of that. Even though the license is on a list, it doesn't mean you will get it without, just like that. So we do have to do a risk assessment on each and every request we get in. So complex, and also to note that complex and high risk moves will also need extra time to process. So please do, when you do apply for the license, at least give us at least 5 days notice, and even longer. I mean, if you know that you'll be moving animals for whatever reason, and you know that well ahead of time, it is always worth to apply even before those 5 days. So movement controls, so that are allowed, that you can apply for, and hopefully you will receive them if the risk is low, are of live animals within the control zone. So that's from a place within the temporary control zone to another place within the temporary control zone. and also for animals that are outside of the zone, so they're not in any control zone, into the control zone. Then there's also moves to slaughter which are allowed, so that's from a premise in the temporary control zone to a slaughterhouse within the control zone, or from a premise in the temporary control zone to a designated slaughterhouse outside the control zone. At present, we just have really one slaughterhouse that has been designated, and that's ABP Guildford, as far as I know, but someone might correct me on that if I got that one wrong. And there are further designations coming up in the very near future, but we will keep you, as soon as we know which ones they are, we will let you know. And then also from a market to a slaughterhouse within the temporary control zone, that's allowed as well. Now, some moves are not allowed, so they are movements of animals to slaughter from premises within the temporary control zone to undesignated slaughterhouses. So the slaughterhouses outside the zone do have to be designated. And any movements of animals to live out of the control zone is also not allowed. Now, this evening we've heard that we have now a license that will allow moves of live animals from premises inside the temporary control zone for welfare reasons to outside the control zone. So, as already stated, a risk assessment will be undertaken and it will be assessed. So it's not a given that you will get that license, but if it's an urgent welfare reasons, definitely please do apply. It can also mean that either pre-movement or post-movement testing will have to be done by the owner. And then there's the usual other license conditions. So I just want to end to say that if you do suspect blue tongue on your farm and we will see some of the symptoms that you could be looking out for, please do notify us. We've got our services helpline, which I've added here. Should that be in Wales or Scotland, please contact people there. And the numbers are here as well, but I'm hoping that is never going to be the case. And yeah, hopefully this has sort of explained a lot of what's been going on in the background. So thank you.
That's great. Thanks very much, Sasha. That was really very thorough. While we're passing over to Rudolph's going to come in next and just update us on the clinical signs of blue tongue. But while we're doing that, I believe we've got a question that's come in that is specific to your presentation, Sasha. So, Neris?
Yeah, so questions come in. Why do you not put a new 10-kilometre zone around each farm where you find a new case of blue tongue?
Because those cases are found within the control zones. So hence we don't need to put an extra control zone out. And as you've seen for the Sandwich Bay area, we extended the control zone to cover those areas that were actually new. So they fell outside of the zone. Hence, that's the reasoning behind that.
Okay, lovely. Thank you, Sasha.
Is there anything else, Neris, or is that's that? Let's move on, shall we? In the interest
of time. We'll move on in the interest of time, because some other things could be, multiple answers. So I just thought that was one direct for Sasha. So
that's excellent. That was great. Okay, Rudolph, over to you.
Okay, is that working? My screen?
Yes, it is. Yes.
Okay, thank you. So yeah, so these slides were put together with the help of my colleague Vanessa Swenson, who's my equivalent, but for cattle, with help from APHA colleagues, GD De Venter, who's the equivalent of APHA in the Netherlands, and then also BCVA. So just to explain a bit why we see the clinical signs, and starting with the incubation period, so from when an infected midge bite an animal and it's showing the first clinical signs, could be anything from 4 to 8 days. And the lesions are associated with where the virus replicate, and it causes damage to the lining of the blood vessels. That will result in bleeding. And then because the blood vessels are damaged, the area doesn't get oxygen supply. That causes inflammation. Then you get swelling and a reddening of the area. And you can also get fluid leakage. That gives you fluid accumulation that adds to the swelling. And these lesions are common in areas subject to mechanical damage and abrasion. So we're going to see that in the feet, the mouth, eyes, and teeth more often than in other areas. So when we start with sheep, because they are most likely to show clinical signs, but keep in mind that a lot of infected animals will not show any clinical signs. And again, some infected farms may not have any animals with clinical signs at all. Some farms may have many more. So fever is the one thing you may not see, but you're going to see drooling. The animal is ill, depressed, it's stiff, it's unwilling to move, and you may see panting or difficult breathing. Initially, you get a clear nasal discharge that then becomes thick and purulent, and it can dry and become a crust on around the nostrils. You may also see a reddening of the conjunctiva around the eyes, or again around the muzzle and the lip areas as well. And the face can become swollen. And in severe cases, you may see animals dying in 8 to 10 days, or there can be a long protracted recovering period. So if we look at the face and the mouth, so we mentioned the swelling of the lips there and there. And then you also get ulceration of the lining of the mouth. You see that on the hard palate, around the lower incisors there, and around the teeth and the molars at the back. The tongue may become dark red and swollen and turn blue, and that's where the term blue tongue comes from. But that's fairly rarely seen because that's a severe case that's going to show you that. So on the limbs, we can see the following. The classic one is the reddening of this edge there, where we go from the claw over to the skin or the coronary band. There's, again, that reddening pink discoloration there. You may have to lift the fleece or the wool there to the hair to see that. And you may also see swelling of the limbs. And the animal is lame. As that animal is standing there, you can see it is ill, it's depressed, it's got his head down, his ears are down, and the way it's standing, it's in pain, it doesn't want to move. So it's an obvious animal that you're going to spot that is not in a good state. And then as it goes on, if it survives longer, then you may get a twisted neck or twisted body because of the infection in the muscles or the damage caused there. So you may also see reproductive and other clinical signs such as abortions, stillbirths, and weak lambs. And in some cases, you may get what we call congenital defects. And very often that means it's damage to the brain, where there's certain parts of the brain that has not formed properly. And you're going to see a live animal, but it's going to behave as a dummy or abnormal walking or difficult walking, and may not be able to suck itself. You can also see ill thrift in animals that's been affected, and you can also see wool break at the later stage, as we see with many diseases in sheep, where it causes fever. So if we go to cattle, again, less likely that they're going to show clinical signs compared to sheep, but again, fever is a common feature, salivation, as we see there, again, the drooling from the nostrils as well. And again, you can see conjunctivitis, and sometimes that tear staining forming below the eye. So it can be very subtle and not very clear cut. As we say, many cases will be subclinical with nothing to be seen. We go to the mouth and muzzle areas. So again, we see erosions there on the inside, like shallow erosions there, but you can also see erosions on the outside areas, on the muzzle around the nostrils, and again the salivation, and then you get the scab formation that can eventually start to peel off as well. We go to the feet. So again, we can see redness there and swelling, and the swelling can go higher up on the limb, up to the first joints there, and eventually that can cause chronic lameness with secondary infections if it is severe, and sometimes the claw may start to come off, although that's more likely to be seen in severe sheep cases than in cattle cases. So as with sheep, we may see abortions. We may also see congenital defects. That's a picture of a calf that was born that was infected in the uterus, and we can see that big part of the brain, the big brain, didn't develop properly, and it's just a fluid bag there. So you can imagine that poor calf will have great difficulty to do anything normal and would not be able to suck at all. So we can also see on the cow's teat lesions, redness and scab formation there. Again, can be very subtle and easily missed. You can also see that scab formation around the perineum and the vulva. You can see reduced milk yield. It's been reported in the Netherlands. It was quite marked as well and seen over wide areas with little else seen apart from that. And it can also affect the fertility. So we shouldn't forget about goats, similar to sheep and cattle, but generally much milder and less numbers affected as well. Again, there will be fever, depression, and then as in this picture, there will be a swollen face and lips. May have a mild discharge from the eyes and the nose. And as in this case, there's a few shallow, small ulcerations on the lips on the outside, and there were similar ones on the inside of the mouth as well. And obviously, when you open the animal, I'm not going to go into detail, but there's damage in the internal organs as well. That's why the animals are so ill, and that's why some of them die. As we see here in the heart, we've got big hemorrhage there in one of the big blood vessels going to the lungs. The lungs itself can be really fluid-filled and really inflamed, which gives you that difficulty breathing that we can see with affected animals. If you go on the inside of the mouth, you can see the ulcerations and damage there goes all the way back, giving you a very sore mouth and a good reason why these animals would not be eating, apart from feeling very ill. Obviously, there will be enlarged lymph nodes and enlarged spleen as well, and you can get this fluid in the heart sac. But again, that's not typical of bluetongue. You can see that with other conditions such as pulpy kidney as well. And then just on differential diagnosis, there is a possibility if you had a positive bluetongue case or a suspect case and it was then tested and ruled out, and then you may ask the question, well, what condition have I got that's causing these lesions? And if it's not obvious and you discuss it with your private vet, then APHA is willing to discuss with you to offer a diagnosis to find out what actually it is, because it's good to know what these differentials are. But in cattle, some of the serious ones is another disease that's in Southern Europe, not at the moment a threat to us, episodic hemorrhagic disease. But there's conditions that we see here like MCF, IBR, BVD, mucosal disease. Obviously, a big differential notifiable is foot and mouth disease, can unfortunately look very similar in some cases. We can also see photosensitization from plant poisoning or other toxicities, giving you lesions that look suspect for bluetongue. On the sheep side, we've had a number of off cases where in some cases when you've got the inflammatory stage without the proliferative lesions, that it can look suspect for bluetongue. Hemonchus and fluke can give you swelling of the head, and again, in some cases that may make you think that you've got a suspect bluetongue case that has to be investigated. So just a few acknowledgements there from colleagues who contributed to put these slides together. And I will stop there. Thank you.
That's great. Thanks, Rudolph. That was great. We're going to pass on now to Sharminda and Jack Bolcombe, both from West Point Vets, down at Ashford in Kent, so very close to the control zone down at Kent. And you know, Jack and Sharminda, I think you're going to talk us through some of the practical implications of what farmers should do if they're contacted, and how they go about preparing for surveillance tests and those sorts of things, and maybe just some of your experiences of what you're seeing on the ground down there. Are you ready to share? Is this going to take very long? Can you share? Neris, while this is going on, is there here we go. Neris, you're going to do it. Well done.
Okay, thanks, Neris.
There you go. Okay.
Thank you. So hi, I guess my name's Jack Bolcombe. Yep, I'm clinical director and lead vet down here at West Point Farm Vets in Ashford in Kent. So I guess our background from this, so we've been working very closely with, alongside APHA in recent avian influenza and with the current bluetongue outbreak that is going on. So I've been asked to briefly sort of talk about what to expect in terms of the overall process. So Sasha sort of outlined a lot of those sort of key facts as to what's going to happen, but hopefully from our sort of practical experiences from the process. Hopefully it'll help just to run through these things quite quickly. So in these sort of outbreaks, we know that we've got these sort of temporary control zones in place, and you've been notified if we're within these areas regarding the setting up of those TCZs. And then the testing and visits are going to be conducted, as Sasha says, from the centre of those areas towards the outside, with some priority given to those larger cattle units within the zones. So to arrange these visits, so the forward operating base local to the area will be contacting the farmers directly to book in these surveillance visits. And what they're going to do in that initial phone call is just to clarify with you what sort of stock numbers you've got of the susceptible species, so your cattle, your sheep, your goats, potentially any alpacas and what have you there as well, their locations as well. So specifying specific locations in terms of use of what 3 words and Google Maps pins and what have you can be particularly useful with helping us to organise these visits. Often we're over several sites, so logistically trying to get that in place can be quite a challenge. So the more detail we can give in that initial setup, hopefully will help things run smoother on the day itself. We'll then be given a sort of date and time that's convenient for all parties to get that visit in place. So everyone's working towards the same targets. We're all on the same side here, trying to get this testing done as quickly and efficiently as possible in the long-term sort of aspect of trying to get these restrictions lifted and get life back to normal as quickly as possible so these businesses can get back up and running. So when we're preparing for the visit themselves, it's about having enough help there really, and about making sure we've got the appropriate handling facilities at each of those locations where you've got those animals. So we've got the crushes, the races and the holding pens at each and every location. But really it's planning for the worst and hoping for the best. We're getting a lot of animals caught up in very, very small places, but just thinking about escapees and daylight hours at the moment have been particularly challenging for us out on visits, making sure that we've got everything in place to try and like I say, plan for the worst and hope for the best in those setups. So we'd also want to discuss with you and make sure you've got in place all that information that's relevant. So Sasha said that we've got a bit of an inspection which is being conducted by the vet as well as the actual examination of any animals that are ill. And then the blood sampling as well, but it's the records and the data that are particularly important. So gathering that data, so we've got that all on site in one place for the vet doing the inspection to be able to gather. So you've got your evidence of your movement records, medicines, treatments, mortality, and then performance. So your performance may well be your fertility data, if you've got any scanning data from sheep so far, or if we were cattle, it might be fertility or yield data associated with that. And any of that data really is going back to the sort of 1st of September, sort of the key date. But we need any information. If nothing's been treated between the 1st of September and now, we'll want whatever the most recent treatments that you've got. And if you have that all to hand, it's quite a quick, painless procedure to get all that through. And then we can move on with the inspection and the blood sample sort of gathering. So in terms of who's going to be attending the visit, so we'll have that the veterinary surgeon who'll be there. So we've got a team of vets here, but it could be an APHA vet. It may be your own private vet who's working like we are alongside APHA, or it could be another one from another vet from another practice who's being deployed as part of the response. So that'll be an allocated vet. So they will have undergone a fairly significant period of additional training that we all have to go through in terms of making sure that all of our biosecurity is up to scratch, our knowledge of the disease, and hopefully we'll be able to answer any of the questions that you've got on site, or at least be able to signpost you towards the right areas and people to be able to answer any queries that you've got. So you'll have the vets themselves that will do the inspection. You'll also potentially have an individual or a group of APHA veterinary technicians who are these vet techs who have been trained in blood sampling, and I guess just the more people we've got on farm, the quicker the process will be. It's a real team effort to get this done, and like I say, we're all working towards the same aim of getting this testing done quickly, efficiently, the least stress to the animals in quite a critical time period in terms of their pregnancies and what have you, and not wanting to disturb that. get the sampling done, get the results in, and return to business as normal. And I'll hand over to Sharminda to talk a bit more about the ins and outs of the visit on the day itself. We can move to the next slide, please, Neris. Thank you.
Hi, thanks. Yeah, I'm Sharminda. I'm a farm vet working alongside Jack in Kent. We're based in Ashford. I'm also a livestock keeper with livestock in the temporary control zone as well. So I'm kind of from both as a vet, being part of the surveillance work through our clients' experiences as well, and also as a livestock keeper myself as well. So what to expect from the visit when we actually come out to do your surveillance visit? Essentially, the visit is 3 sections. One part of the visit is the inspection of the animals, as Sasha said earlier, by the veterinary surgeon. So this is a group inspection. It may be as the sheep are in the pen, maybe the cattle come up the race. We would then only individually inspect any animals that look to be ill, and then we would examine them further. This is usually happening alongside while the blood samples are taken, which is the second part of the visit, essentially. And that might be the vet technicians taking the blood sample and or the veterinary surgeons, depending how many people are deployed for that visit. So each animal will need to be restrained, appropriately recorded. The third part of the visit, I think Jack and Sasha have probably covered in enough detail, is the history taken, and that's by the veterinary surgeon. And that will be looking at the medicine records, probably taking photos of them, the mortality data, fertility data, any recent movements within your linked holdings, and production data as well. I think some farmers I've heard are worried about this process, that there's going to be comeback on them if there's, anything missed from their medicine records or anything. We're happy to take verbal, if you haven't got it recorded in your records, and so don't miss things because they're not written down, because that information, as Sasha said, is important to know, when you did treat the animals last. So don't worry that it's not written down in your record specifically, but please still give that information. And I understand there'll be no comeback from these visits of information not recorded as such. So don't worry from that aspect, just be honest about what data you have. So I think that's probably, with what Jack and Sasha have said, has covered what actually happens on a visit. I would also say, as vets, either as vets on the surveillance visit or as your private vets, we are here to support our farmers through this. So please don't be afraid to ask questions, either on the visit, on the visits to your private veterinary surgeon, or through the hotline. And if we can answer your question confidently and have the right answer, we will give it to you. If not, we can signpost you to the information that's out there. For example, we get a lot of questions from our clients about the licenses, so we can signpost them to the Ruminant Health Organisation with all the information on the licenses there. And if it's a question we don't have the answer to, we can obviously pass the question on to the right person. But don't be afraid to ask questions to anybody here that's supporting all the farmers through this bluetongue. Okay, that was it.
Excellent, thanks, Sharminda. You were drifting in and out a little bit there. Your connection wasn't great, but I think people got the majority of that. And, no, it was fine. I think people did get the majority of it, actually. But I just want to re-emphasize one point you made right at the very end, which is the importance of just reaching out for help. If you're struggling and you don't quite know what to do and you don't know where to go for information, just speak to people. Be that your local vet or APHA or your membership organization or whatever it might be. Everyone, as Sharminda said, everyone is on the same side with this, trying to make sure that things go according to plan and we don't end up with things happening that officials aren't aware of. So just be open and transparent as far as we can, I think. Okay, we're going to move now into a Q&A session. Before we do, I'd like to just remind any ROSA members, Register of Sheep Advisor members, to put their membership numbers in. I know a number have done, but if anyone hadn't done that, put your membership number in, and there's CPD points available for tonight's webinar. And just to say as well, we've got Peter Mertens that has joined up. As I said earlier, Peter is an expert in vector-borne viruses and MIJ activities. So although he's not presented, if there's any specific questions around that topic, do put them through. I know that Neris has got some good questions that have come through, and I would just like to throw out to the audience that this is probably mainly, but possibly not exclusively, a sheep audience tonight. There likely to be some cattle farmers on tonight as well. But what we'd like to know is any immediate challenges you're seeing now, or any that you see facing you. I think we're picking up a lot of these in the discussions that are taking place 2 or 3 times a week. But we're really keen to know what people are feeling on the ground and some of the big challenges that you're seeing. So get those points across in Q&A if you can. Okay, so Neris, over to you really to pick up on some of the questions that have come through.
Okay, so I may direct them at somebody, and if I've directed it at the wrong person, just say, no, that's not me. And if you can nominate someone else, even better. This might be a joint question for both the practicing farm vets and maybe Sasha. So can we expect that surveillance testing will be taking place over Christmas or during the Christmas New Year period?
Right, I'll take this one. No, over the period of Christmas, we won't be undertaking surveillance visits, which include sampling, but we will be undertaking stock takes. So these are visits we might do if we can't contact people via phone, we might just come and knock at the door to see what kind of animals there are, if at all any, because it could be that they don't have any anymore. So you can expect something ongoing over the Christmas period. And also, obviously, if you have a report case, so if you're worried about any kind of disease, notifiable disease, we will come out and look at that, as well as any tracings if there are further positive cases.
Okay, so if anyone does suspect a clinical case over Christmas, New Year, still report it, as it were, but there's not the routine surveillance in. So I think, yeah, that's good for people to know. Okay, brilliant. Would subclinical or low-level infection in a ram affect body temperature enough to lead to depression of semen vitality? That's probably Rudolph, is it? Would you like to answer that one?
I'll try and start, and then I'll leave it to Peter, because I think Peter will be the expert on that. But I don't think you have to have full clinical signs to have an effect on sperm quality, because I think it's been described certainly in the previous strain. Obviously, this is a new unique strain, so we don't know everything about it yet, but I think it can be possible. Hopefully it will be a transient thing, but it can also be transmitted through semen. That's been described as well with previous strains. But I think I'll stop there and leave it over to Peter, because he's probably more of an expert in that area.
Yeah, I think if there's... Oh, sorry.
Yeah, go on ahead, Peter.
Right. Yeah, if the animal is infected, then there can be an immediate effect on the quality of semen. It depends how severe the infection is and how high the pyrexia is and so on. But the thing that would concern me more is that the virus can persist in the testes for really quite long periods of time. And there is potential, I'm not saying it'll happen every time, there is potential for the semen from that animal to be infected over a much longer period. It's one of the persistence and possible overwintering mechanisms that the virus uses. So if you're worried, get the semen tested even. PCR tests will pick up bluetongue in a semen sample.
Okay, and just to clarify, pyrexia is a high temperature, isn't it?
Yes.
Just
Sorry.
Okay.
Yeah, sorry, I'm in fever. Yes.
Yeah, fever. Yeah, okay, brilliant. So this is really good, and probably still for you, Peter. In the previous outbreak, there was a vaccine available fairly quickly. Is there one in the pipeline for this strand?
I have to slightly disagree with that fairly quickly, because what actually happened is that the BTV8 outbreak occurred in 2006 in the Netherlands and didn't get to the UK until 2007. And then we had a relatively small number of cases. So if you like, we're a year ahead with this outbreak. And last time that gave us an extra year to develop a vaccine against BTV8, which was very successful. Unfortunately, that vaccine won't work for BTV3, and we need to go through the development and licensing process of a vaccine really from scratch. And I think that's probably where the vaccine manufacturers are at the moment. I don't know if that answers the question.
I think it does. I did see on Twitter over the weekend people saying, "Oh, there's a live one in South Africa. Can't we just get our hands on that one?" Is it worth saying a comment about that as well? That it's not that simple.
Yeah, I think the live vaccine is for the European situation would be exceedingly dangerous. In South Africa, the virus is spread everywhere. There's multiple serotypes and so on, and the only purpose of vaccination is to protect the animal. Onward transmission doesn't matter because the virus is everywhere anyway. In Europe and the UK, the virus, certainly in the UK, the virus is not present. So what we're trying to do, protect the animal, sure, but one of the most important things is to prevent onward transmission. If you use a live vaccine, that's actually live virus that's a bit attenuated in an animal, that animal becomes infected, right, with the vaccine virus. And from then on, you have no possible surveillance with that animal. It will always come up as infected, and it will always come up as antibody positive. So if you use a live vaccine, there is no, you're blind from then on. And so it's really difficult. And I have to say, it must not be used. Also, the live vaccines can interact with the circulating field strain and can revert to virulence. So all you're doing is increasing the genetic variability in the pool of virus that's out there in the field, and that is exceedingly dangerous.
Okay, thank you. That's answered that very well. And the first half, that the person has said yes, that has answered the question for the first part as well. So thank you, Peter. We've got a couple more coming in. So this is directed at Shaminda and Jack, but it might be that Sasha would like to answer this as well. How close to lambing would you be willing to blood sample use?
I mean, we would.
Shaminda, you're breaking up badly.
Take small.
Shaminda, you're breaking up really badly.
From using the run up to lambing for things like nutritional profiles.
Shaminda, you're breaking up really badly. You might just try turning your camera off, unless Jack.
Oh, okay. Okay, is that any better?
Yes, it does sound
Yep.
better. Yes.
Okay, that's right. One of the kids had turned on their gaming again. So, I mean, we would routinely take some blood samples from sheep kind of 4 weeks pre-lambing, but that would be small groups of sheep for things like nutritional profiles. I wouldn't want to be, mass gathering pregnant ewes, any closer than 4 weeks to lambing, if not 6 weeks. I mean, normal recommendations is not to doing very much in the last 6 weeks of pregnancy for ewes. But I think it's also important for people to bear in mind, as Sasha said, with the licensing, that if you're applying for licenses to get sheep back to your holding for lambing, that make sure you do that in plenty of time to allow for potentially, any pre-movement testing if you're having to move, from in the zone to out, so that testing can be done well in advance of actually lambing itself.
And I'd just add on there, for surveillance purposes, we obviously need to test as many animals as we can, and especially in the priority areas. And we are talking to the welfare teams to make sure that when we do sample heavily pregnant ewes, and it might be needed, that we do that as calmly and as quietly as possible, to ensure as little loss, well, no losses, put it that way. We have already sampled bigger herds and it's gone really well. So it's a case of working together on this and ensuring everything goes really calmly.
Okay. And perhaps stick with you, Sasha, so this might be one for you. Who is likely to be covering, if we get down to the pre and post movement test situation, who's likely to be covering that cost?
So at present, we're not totally sure. The cost would be for the owner, for the private vet to come and send the samples to the lab, but it could also mean that the cost for the testing also lies with the owner at the lab. But as I said, that is to be discussed. I did make a slight mistake on my slide saying it was pre-movement testing or post-movement testing, but it's pre-movement testing and post-movement testing, just to be aware. Right.
Okay. So that's one to just to keep our eyes and ears open about when that information comes out. Okay. Brilliant. The next question that I had, probably I'm not sure who would like to take this one. Can you give some advice about pre-lambing boosters of clostridial vaccines to sheep? Should you use a different needle for each sheep to avoid the risk of transmission of bluetongue? Who wants to answer that one?
Well, I can answer on the needle thing. We did some work with Karen Darple at Pirbright showing that you can transmit bluetongue from animal to animal by needle. You know, successive vaccinations of using the same needle will pass the virus on. So you either need a completely new needle, or I believe there might be some machines that sterilize the needle between each shot, but then that's another expense. So easiest thing, just change the needle every time.
I think the Stereomatics you're meaning, Peter, have been taken off the market over the last year or two. So if we're thinking the same thing, am I right, Phil? Yeah, the Stereomatics.
Right. Yeah, it's come off the market. There will be some people that have still got their equipment on farm, and there will be some people with Stereomatic caps still on farm with a stock, but you can't get them anymore. And yeah, I was going to ask that really, whether people think that if you know, farmers do have Stereomatic caps out on farm, if they would be effective at sterilizing and stopping any transmission.
Do you think they would be effective, Peter?
I think that the work that Karen did suggested that they do work, but you know, the equipment's got to be in good condition. You've got to have it in the first place, whereas changing a needle is pretty easy.
Yeah. Okay, thank you. So somebody's asking, so there was a comment, Rudolph, that you said that sheep are more likely to get clinical disease. We are seeing the majority of cases currently in cattle. Why do we think, I know they're different because the cattle aren't currently showing clinical disease, but why do we think we're seeing more in cattle than sheep currently? Several of you could possibly answer that one, but who wants to get there first?
Yeah, I'll start and others can add. Peter, you probably know the full story much better. I'll leave it to you.
Well, cattle, I mean, basically they're bigger. The semiochemicals is what they're called, that attract midges to feed on the animal. Bigger animals produce more of them, and so they represent a more attractive target, if you like, for midges. And a cow can be bitten by thousands of midges in a single day. But as well as that, they're not as furry or hairy as sheep. And the midge, it's a tiny insect. It's got to get somehow through that in order to bite the skin. So midges frequently bite underneath in the joints of the legs and around the face with sheep. But cattle, I think it's a lot easier for the midge to get through. Cattle also are more important in terms of onward transmission of the virus because they tend to have a higher virus production in their blood, and the virus persists in them a bit longer, whereas sheep tend to be more of a, dare I say it, a dead-end host. They will transmit, but they suffer much more severe clinical signs.
Okay. Is there why do you think sheep do suffer from more clinical signs?
You know, that's an impossible question.
Yeah,
I think that the answer is they just do.
They just do. Yeah.
Okay. Cows can have a high viremia, you know, which is, you'd think might be linked to the severity of clinical signs, but the two don't appear to be directly linked.
Well, that's just leading on to another question. So why do we think we're finding clinical surveillance at the moment, but not exhibiting clinical signs?
Well, I think firstly because a lot of them are in cows, and I think the percentage of cows in the BTV8 outbreak that had fatalities was less than 1%, whereas sheep was up around 25%. So the number of cows that are severely affected is very, very much lower anyway. Also, there's this question about how long ago were they infected? You know, if they were midges blown over in September, we're a good bit further on now, and a lot of the animals that are infected in September would be expected to be more or less over it by now. So in sheep, well, we've got so few sheep infected so far. I don't think we can make a firm answer about it. I don't know how severe the clinical signs were in these sheep that were infected, if any.
Yeah, as far as I know, I don't think there were anything obviously recorded, were there, Sasha? I think the other possibility as well is when the midge or the plume with infected midges came over, it's obviously low numbers. So I think the initial viral injection in these animals were probably pretty low as well. So the immune system probably could get on top of it rather quickly compared to, say, an animal in the Netherlands that gets bitten by thousands infected midges and gets a massive viral load very quickly.
That certainly may have had an effect. I mean, from experimental work that was done at Pirbright, if you sort of bypass the feeding mechanism in the midge and actually inject the virus into the midge so that you know absolutely it's infected, then subsequently a single bite from one fully infected midge will reliably transmit the virus. So, and the process of midges coming over from mainland Europe, I mean, you know, that's quite a difficult task for any midge to do. And I think the number that actually succeed is usually pretty small. And during BTV8, we only found 2 lineages of virus arriving in the UK, which suggested that the virus may only have arrived once or twice during that whole period. So it's difficult to say.
Okay.
Yeah, I just wanted to add, of all the animals, the positive animals we've had none of them show clinical signs, and neither do the owners know of any clinical signs prior to that. So just to mention.
Well, long may that continue.
Yes, absolutely. So sticking with you, Peter. Somebody's asked, why haven't all the midges died out yet, given that it's winter?
Well, the 2 things. Midges are quite happy to fly around at, you know, anything down to sort of around 5 degrees. They're not particularly fussy about temperature. They will still do things. Frosts will usually kill off midges, but you know they can survive in foliage and things. Anything that protects them from frost will help. But even if the adults that are flying around at one time are killed off by frost and so on, new midges will emerge. They won't be infected as they're newly emerged, but you can see on a warm winter's day, you quite possibly find midges flying around. But they are reduced risk because they are not infected because they've newly emerged. If any of the older midges have survived, they might still represent a threat, but it's a diminishing threat all the way through.
Okay, thank you, Peter. So possibly one for yourself, Sasha. At what point will the TCZ be lifted? Might be a difficult question. You know, is it dependent on sampling finishing, or I mean, this, yeah, like I say, maybe a horrible question, but there we go.
Yeah, that's a very difficult question to answer. We continue to undertake the surveillance to understand if disease is circulating or not. And ultimately, I think that answer lies with the epidemiologists and our disease consultants to understand what we need to do next. But we keep finding positive cases. So I think it's still a long road here. So we'll have to see and watch this space. That's what I can say.
Okay. So we've had another question in just asking about anything that farmers can do, effectively trying to kill the midges off. So does anyone have any comment on should we be using any insecticides? Can we use any nets? What about garlic? Does anyone have any information on any of those, please?
Well, I can make a comment about a bit about insecticides. Poor on insecticides are probably of very limited value. One, you would have to maintain their level all the way through the period of risk. But secondly, they would need to be very, very fast acting, because if a midge flies in, you've got to kill it before it takes its first bite. And their intention of landing on the animal is to take a bite straight away. So generally, I would think insecticides are going to be poor at stopping the animal becoming infected. What they might do is the midge might die as it flies away, so they might help to reduce onward spread. But in terms of initial infection, my guess is not so much. If the animals are housed and there's netting over the air passages into the building and so on, that are small enough to exclude midges, and particularly if those nets are treated with insecticide, that might help. Plus, midges don't like high wind speeds. I think something like about 5-10 kilometers per hour wind, they tend not to fly. So if the air circulation in the building is rapid, that might help as well. And then there's the question of where they breed. The midges tend to breed in organic rich soil. So things like the areas around dung heaps and so on, if they're kept further away from the animal housing, from the animals, that again may have a beneficial effect.
Okay, so that's something that somebody could feel they could do. Mandy, did you want to come in there? Sorry.
Yeah, I was just going to come in and say that I think we've got to be very careful about widespread use of insecticide when the efficacy has not been proven. You know, then they're not, they don't discriminate, they don't kill culicoides above other insects, and we don't want farmers going out there, you know, applying insecticides to dung heaps would get runoff and things like that. So environmental contamination has got to be a consideration. And I think also we've got to be very mindful that a lot of farmers will be financially constrained with bluetongue. It's going to put financial pressure on them, and to be spending money on product that has very limited proven efficacy, I think is not the right message. So just a word of caution. I do accept that people want to be doing things where they can, but I'm not sure that insecticide is going to be a good use of their money.
No, absolutely.
Okay.
I'd agree with that. And I also think there's a bit of an element of panic at the moment. Understandably, it's fear of the unknown, but it's all about controlling the controllable risks. So there was that conversation about vaccination and needle transmission. So it's thinking what practically you can do. And yes, without stereomatic, you might be thinking about surgical spirit and cotton wool in terms of disinfection needles if you're reusing them, and doing what you can in terms of reducing those obvious risks. But just thinking logically about your day-to-day activities and what you might be able to do to reduce that contact and reduce spread either by yourself or by insect, I think is important, but not to lose too much sleep over things that are beyond your control.
I think Judith's put an important comment in the chat as well, that we should be mindful of withdrawal times of insecticides too. So yeah, very important point, Judith. Thank you.
Yeah, thank you. So regarding your findings of the 23 PCR positive animals, are midges caught in that area and also tested by PCR? Is that?
Who's that for?
Is that for you?
Is that for you, Peter?
It's actually you're on mute.
Well, I don't have any control over what the testing's done. I think there's been some midge trapping at Pirbright, but that's only to see if the midges are still active at this time of year. I don't think, well, I don't know if there's any trapping in the control zones, but in previous outbreaks in other countries, the number of midges that are actually infected out there in the cloud that's flying around is so low, you would be enormously lucky to find a positive one. So it's practically, in terms of surveillance, it's not a useful thing to do. In terms of research, it might be interesting, but not as a way of finding an outbreak.
Yeah, so just to add, we are trapping midges, and it's more to understand about the midge, the vector low period, and so we're trapping midges on our on various places in the country, and mainly in the higher risk areas. And every week they are counted to understand how many female midges are still having blood meals, to understand that. But we are not testing currently those midges, as far as I know, for PCR.
Okay, great, thank you. So I think I don't know if I've missed a question, if anyone else has spotted one that perhaps we haven't answered.
Could I just come in? I mean, given we've got such a prestigious group of people here, you know, to ask the question about, I don't know if anyone can answer this, but what are we predicting for this next sort of 3 months? What should we expect to see?
Shall I get a glass ball for everybody, and everybody can look into it and see whether we see something different?
As we've said, you know, there will come a time, hopefully, when the temperatures drop and
Yeah.
you know, the midge populations will drop. But, you know, all the predictions are that it's going to re-emerge again. We don't quite know when. You know, what as experts, what might you think we could have?
I can offer. Sorry.
I was going to say I'll start it off, Peter, and
All right. Yeah. Please do.
Just say that I think whatever we say is likely to be wrong.
Yeah.
Because there are too many variables, so it will be, you know, it will be very dependent on things like weather that we've got no control over. But I'll let Peter give a much more scientific answer.
My crystal ball's not working, so this is now guesswork, and as long as that's acceptable, the thing is, transmission in the UK is the worst possible thing. Look what happened in the Netherlands. It went from a few cases to thousands of infected premises within a matter of a few weeks. So that's a real outbreak, rather than simply introduction of a few infected midges, which is probably what has happened so far in the UK. In order to avoid an outbreak, the thing that probably stops an outbreak most effectively is low temperatures. Below about 15 degrees, certainly below 10 degrees, the virus is almost inactive. It has enzymes inside it that are adapted to replication in cows and sheep. So has optima around 38 to 48 degrees, you know, and if you get right down to low temperatures like in winter, then onward transmission is going to be very much curtailed. And I'm rather pleased, Phil, you said over the next 3 months. Well, I don't really expect temperatures to rise dramatically by the end of February. So I would suggest over the next 3 months, we may find a few more infected cases, probably that were infected perhaps a little while ago by blown-in midges. But I don't expect there to be any in-house transmission, as it were, here in southern England. I don't know, but as Mandy says, you know, this is now guesswork.
But I guess that does all lead to the just to re-emphasize the importance of the surveilling and the tracing and the taking out of infective animals is going on at the moment, and the importance of everyone doing what they can, I guess, to support that surveillance operation.
Yeah.
Yeah, excellent. Okay, Neris, we're done with questions, yeah?
There's just one that's come in at the end, and I think, were the infected animals virus positive or antibody positive?
They were virus positive and antibody positive. So the animals react quite quickly to the virus, but maybe Peter can say more on that, on how that works.
Yeah, in terms of infection, after infection, the animal will start to show circulating virus somewhere between 2 to 3 days. and then the virus can be detected for really quite long periods of time, over 100 days sometimes in sheep, and sometimes even as much as 200 days in cattle. But the virus only remains infectious probably for 2 or 3 weeks in the animal, and because the development of antibodies will neutralize the circulating virus. So they go positive in terms of antigen or PCR first, and then a bit later, maybe around 8 to 10 days onwards, they start to go positive for antibodies. But you know, once you got both, then all you can say is definitely that animal was infected.
Excellent. Okay. Well, look, it's 8:45. We said we were going to try and finish by this time, and we're just about going to manage that. So thanks to everyone for keeping on time. I also said earlier that this is the first in a series of webinars, and we will continue this into the new year. You know, this is these webinars are open to everyone. This is all about trying to get information out there, get a higher level of understanding, I guess, and we don't want to restrict the communication that's going on. So we'll continue this, and we'll also try and broaden it out as well to wider audience, and maybe bring 1 or 2 other organizations in so that we can share it amongst their membership. So we'll continue that, and that will be obviously updated with new information as it comes through, and you know, the most up-to-date situation. So we'll keep everyone informed, both via certainly through NSA media routes, and I'm sure through AHDB media routes as well. We'll keep everyone informed. The recording of this will be circulated around all the people that we've got that have registered for tonight, and it should be available on our website as well. So I think probably that just remains for me to thank our speakers for tonight. Sasha, Rudolph, Jack, Sharminda, thanks to Peter and Mandy for joining the Q&A panel. It's really, really valuable. And a big thank you to Neris as well for being our question master. So thanks for that, Neris, and for Emma in the background, who's been keeping the platform all working. So, and then finally, thanks to everyone that's joined us and listened in tonight. I hope you found it useful. And as I said, we'll keep in touch, and hopefully see you when we've got more to report in the new year. And in the meantime, you know, just wish you a peaceful time when Christmas actually does come, a peaceful and enjoyable time. I know this will be on at the forefront of a number of people's minds. I know it will be through Christmas, but there'll still be time to relax and enjoy it yourselves, hopefully. So thank you very much, and see you soon.
Yeah, cheers, Phil. Thank you.
Bye.
Thanks, Naris.
Thanks,
Bye.
all.